Hello everyone, I'm Erica.
And I'm Akilah.
Welcome to HeartsChat. So tonight we're talking about, should drug addiction and mental health disorder be perceived as the same? So having a drug addiction and a mental health disorder, is it the same thing or something different? Should we look at it the same or not? That's what we're talking about tonight. So before we get into our topic, we're going to do our little check-ins. What's new with us? Let's see.
Instead of here trying to think. I guess with me, I just feel like I have all these opportunities that are coming my way, positive opportunities that are coming my way that I'm basically seizing, because there's all this negativity everywhere around, and I'm trying to, be a little bit more positive about life in general. So, along with, having these positive opportunities, I'm also trying to create and attract positivity to myself too through, taking this 30-day no complaining challenge, focusing more on the gratitudes that I have every day, not necessarily documenting on Instagram how it was last year, but documenting in my journal that I keep every day. So that's really what I'm up to. How about you, Erica?
That's really cool. This is a written journal that you're doing?
It's my bullet journal. I just keep it. I do have my to-do list, and underneath it I have gratitude, who I spoke with that day, my mood and all the stuff, just tracking different things. Yeah.
Because I know my sister has been doing a video journal. And she's been doing videos and talking and doing that. I'm like, wow, that's pretty cool.
That is cool.
It's like a time vote kind of thing.
Exactly.
Yeah, but that's good. All the positive things. That's
Trying.
Nice. Yeah. Man, I had my check-in and I lost it. Oh, I know. So, with the holidays coming up, I've just been thinking about that.
Yes.
Not so much Christmas.
Oh, Lord. I just get anxiety when I think about Christmas now.
Yeah.
But go ahead.
Thanksgiving, my sister that's in Texas isn't going to be able to come home because she has to save for the wedding coming up. And it's just very expensive. And she has other trips because the wedding will be in Ohio. So she has to plan strategically the times that she'll come to Ohio. Just can't be come back and forth willy-nilly all the time. Yeah, so we're not going to be together. And then we were thinking about going to visit her, all of us going to Texas. But at this point, it's kind of last minute. And it's $700 and $500.
What?
For one ticket.
Oh, my God.
$515 was the cheapest I saw. I was like, oh, my God. And with everything with me going on and all that stuff, I'm like, ooh, that's a lot.
That is
a lot right now. So that's just something I've just been thinking about. It'll be, I think, our first Thanksgiving apart.
Okay.
In all this time.
Put her on the screen. Put her at the seat.
Yeah.
At her normal seat.
You're right. That's a good idea. That's a really good idea. I'll probably have to do that. So I don't know. That's just going on with me. So.
Okay.
So getting into our topic tonight, should drug addiction and mental health disorder be perceived as the same? Very tough question, I think.
I don't know. Mm-hmm. I think I'm in the group of people who it's they are different. Mm-hmm. However, drug addiction can lead to mental illness. Mm-hmm. So I don't know if they can be considered the same if one can cause the other.
Yeah, because I think the other way around too.
Yeah. I'm thinking, the other way around. If you're depressed, you might start drinking or
smoking
and things like that.
Yeah.
But if you're not and you're oh, curious and try it, it could lead to different things. So I don't necessarily think they can be considered the same.
Mm-hmm. Yeah, I agree. I guess that's one. We have to take this apart piece by piece.
Yes.
Because I agree they are not the same. There's that. And that's why there are different treatment facilities for them. But I agree that you can have both.
Oh, yes.
And they have to be treated differently.
Exactly.
I think because the thing with, I think what really makes everybody think I don't know, I'm stumped. What stumps everybody is the fact that I think there are certain mental health disorders that, you can go back and say genetics, that this runs in your family, you have this, or you had this since you were a little kid, or you had these mental health issues, you didn't do anything to have that. Or there's a lot of times where kids will develop certain mental health disorders based off their environment. Again, they didn't do anything. And even adults, you didn't do anything to say, I want this. And then there's drugs where you say, I chose to try this.
Yeah.
I'm sure there's probably all kinds of different scenarios and things like that. But at some point, you chose to try this. You did it. You did it again. And you weren't just born with this.
Yeah.
I think that's the part that gets a lot of people. No, that's the part that gets me.
Yeah, I think with just taking mental health out or mental illness out of the equation and just on drug addiction, it's most people believe like it's not a disease or anything because you chose it. Mm-hmm. Like it's not something that, like you said, like that just kind of happened to you or developed in you or came from a family. It's like you chose to pick up that or this. In most cases, like obviously there's cases where some people are forced and things like that. But those are like we always say, there's exceptions to everything.
Right.
But when we're talking about most cases, it's like you're curious or you want to try it, and then ultimately, whether you have addictive personality or traits and things like that you get stuck and you become addicted to these drugs. So I think a lot of people have a hard time thinking that drug addiction is a disease.
Right. I think, thinking about the environment that the person grows up in or what they're exposed to or what their life has been like, I think can make people a little bit softer, maybe more understanding. And there are people, of course, that get addicted and they don't want to be anymore.
Yeah.
And they're trying, but people have such a hard exterior about it that no one wants to help, or they they experience a lot of negativity, and then that's just one part, one part of it. But I definitely think it's different, and I don't know, I really do struggle thinking about is it the same thing, because I can have a lot more empathy for somebody that has a mental health disorder versus someone that is addicted, just generally speaking, not speaking to their story and maybe what happened to them, but just generalizing it. That's what I think about.
Yeah. And I feel like that's
I think we struggle with this because we're both such heartwarming people. Yeah. We really want to help people, and we can really empathize with people in their situation. So it's definitely hard to say, is this or is that?
Yeah, exactly. Because I'm sitting here trying to think, like, where would I fall in that? Like, if I would be, I would probably be more sympathetic for those with the mental health.
Yeah, there's just so much to it. And you find that in that situation, again, just speaking generally, people have burnt bridges.
Yes.
They burn bridges, there's the manipulation, there's the lies and things. But then you take someone with a mental health disorder that can have those exact same symptoms. So again, it's like, why is it different when you have the exact same symptoms? I
think it really does come down to, like, choice.
Yep.
That's really what it is. Like, for people, it's like, why are you choosing to do this to your body?
Yeah.
Like, unless it really is like you had a mental health, it gets really tricky. But in general, if take just a normal person, whatever normal is, like healthy, like, and you just try, like, why are you choosing to do this, knowing this, and this about it? Like, what could happen?
Right.
I think that's why it's so hard for people to think, because like once you do try it, like, I think and you become addicted, like, then that's the drug taking over your body. Like, that's where it's like, it really is a disease at that point. I think it's just the initial, like, how it starts for people, like, that confuses people.
Right. I think that's why, in this sense, we're talking about it and we're generalizing things.
Yeah.
But at the same time, when you get down to it, then you can't generalize it.
Oh, no, yeah.
Because there's a different case for everybody. But I think you can't, I just think you cannot put mental health and addiction in the same category. I think they're two complete different things. There is, like we said, what comes first, chicken or the egg? There is you can have mental health disorder and it can lead to addiction. You can have addiction that leads to mental health disorder, or
vice versa.
Right. But once you have one or the other, they should not be treated the same.
No, not at all. Has to be two different ways of treating it, because they're ultimately two different things. And I actually worked, this is maybe not surprising, but I actually work with a bunch of people who are currently using, and mind you, I work with teenagers, so let's talk about that as a whole other thing.
Yeah.
And I find that although they are two different things and they need to be treated differently, the reasoning behind, well, as a teenager it's a little bit different, but the reasoning behind, like, you know, this doesn't work unless you want to change, or if you're not ready to attack your drug, like, I think the reasoning behind the treatment of getting treatment and treatment actually working is the same. Mm-hmm. But it's, you're ready, you're at that position where you're like, I've had enough, like, I need to do something to better my life, whether it's mental health or drug addiction. I think the reasoning behind it can be more often than not the same to getting the treatment and the treatment actually sticking.
Right. I think another thing that can be a little bit confusing is, what do you tackle first? Do you tackle the mental health disorder first, or do you tackle the addiction first?
Go ahead.
I think that's why providers really need to be collaborative and collaborate with different providers and people that have different modalities, different treatments to, you know, better help the client.
Yeah, I mean, that's hard. I think it's based on it could be based on what came first. Mm-hmm. But I think especially with drug addiction, like, I think you'd have to stop using the drugs in order to work on the other stuff, because if you're still using it, like, it's still impacting your brain and how you're thinking and what you're doing. So without stopping that part, I don't know if you could work on the other.
Yeah. Definitely a vicious cycle.
It really is.
Yeah.
It really is.
All right. That was kind of a down one today.
Yeah, it really is. I mean, but it's real life. Like, this is happening probably more often than people think. Mm-hmm. So I think it's important to kind of get informed, especially, like, the family members and stuff.
Right. I think don't take substance abuse lightly.
Exactly.
You know? Especially, I mean, it's different. You have adults. Adults are doing what they want to do, but adults still are, you know, people. You still have friends, you still have family.
Exactly.
And you still need help if you're an adult. So if you have a friend or family member that's an adult and you see them going through this, try to reach out to them, you know, get them some help. Or if you're an adult, you know, get some help for yourself. And I think parents for you know, adolescents, teenagers, and even, you know, your young adult children, help them, you know, to get help too. Like, if you see, because I know marijuana has become, like, a lot more common, but a lot of kids with anxiety or depression will smoke.
Yeah, self-medicate. Mm-hmm.
Yeah, and that's not to say it's just they're doing something to fit in or for peer pressure purposes, or just because they like it. There could be a serious issue there. Mm-hmm. So making sure to get help and look out for the signs.
Yeah. I think that's...
Okay, so we will catch you next time. If you have any thoughts, as always, leave us a comment or send us an email. Maybe you have a different perspective than us about this, or you want to just keep the conversation going. So we'd like to hear from you, and we'll catch you next time.
Bye. Thank you so much for listening to HeartsChat today, where we speak from the heart. We hope that you enjoyed our show. Catch us every Sunday and Tuesday at 7 p.m. Eastern Standard Time on our YouTube channel and on our website, which is HeartsChatRadioshow.com. Be sure to follow us on our social media pages at HeartsChat Radio on Instagram and at HeartsChat on Twitter, Facebook, and Periscope.
We love to hear from you. If you have any comments or questions or topics that you want to hear about, you can email us at HeartsChat@HeartsChatRadioshow.com. And for all of your personal relationship questions, please visit my blog from ericasheart.com. Thank you for listening to HeartsChat, where we speak from the heart.
Wow.